Hello everyone. Today I am going to give you some information about diabetes. Its actual name is diabetes mellitus. So what is meant by diabetes? It is a long-term disease with variable clinical manifestations and progression. It is now seen as a heterogeneous group of diseases characterized by a state of chronic hyperglycemia resulting from a diversity of environmental and genetic factors. There are two types of diabetes, type 1 diabetes and type 2 diabetes. Type 1 diabetes is the most severe form of diabetes. It is usually seen in individuals less than 30 years of age. It is lethal unless diagnosed and treated. It affects mostly in children aged between 10 and 14 and occasionally in adults. But the type 2 diabetes is much more common than the type 1 diabetes. It is discovered by chance. It occurs mainly in middle-aged and elderly. Now we can look into what causes diabetes. The two most important factors for the development of diabetes are the unfavorable modification of lifestyle and dietary habits that are associated with urbanization. The epistemological determinants are two: the host factors and the environment factors. The host factors consist of age, sex, genetics, and genetic markers. The environment factors includes sedentary lifestyle, diet, and dietary fiber. How is diabetes diagnosed? The earliest and the commonest approach was that the preliminary semi-qualitative test for glucose in a urine sample, followed by an oral glucose tolerance test for those found to have glycosuria. And the new technique is the urine examination and blood sugar testing. What is the treatment for diabetes? Controlling blood sugar levels. The type 1 diabetes managed with insulin as well as dietary changes and exercise. And the type 2 diabetes is managed with non-insulin medications, insulin, weight reduction or dietary changes. How common is diabetes and where it is found? More than 80% diabetes deaths occur in low and middle income countries. The prevalence of diabetes is approximately twice in urban areas than in rural population. The prevalence of diabetes was highest in the Eastern Mediterranean region and the region of Americas. Increase in the prevalence rate of the disease is found in both urban and rural dwellers. Next, we are going to look into who has an increased risk of being exposed to diabetes. The type 1 diabetes is mostly found in people less than 30 years of age. It occurs mostly in children aged between 10 and 14. The type 2 diabetes occurs mainly in middle-aged and elderly people. Can diabetes be prevented? Yes. The primary prevention is that there are two strategies: the population strategy and high-risk strategy. The population strategy is by the maintenance of normal body weight through adoption of healthy nutritional habits and physical exercise. The nutritional habits include adequate protein intake, a high intake of dietary fiber, and avoidance of sweet foods. The high-risk strategy method includes the alcohol intake and oral contraceptives are avoided. Also, it is wise to reduce risk factors that promote atherosclerosis, example smoking, high BP, elevated cholesterol, and high triglyceride levels. The secondary prevention involves to maintain blood glucose levels as close within the normal limits. Maintain ideal body weight. It is done by maintaining percentage of glycosylated hemoglobin, self-care, and home blood glucose monitoring. The tertiary prevention. It is by organizing specialized clinics and units capable of providing diagnostic and management skills of a high order. These are some of the national programs of diabetes. Hope you all liked the video. Thank you.